Welcome to another episode of the Federal Newswire Lunch Hour Podcast with your host, Andrew Langer.
Well, hey there, everybody. Welcome to another episode of the Lunch Hour with Federal Newswire. I'm your host, Andrew Langer. Thank you so very much for tuning in today. And if you're watching us on our Federal Newswire YouTube channel, you know you can take us with you wherever you go on one of the many fine podcast platforms at which you can find the Lunch Hour. You can subscribe there, leave a like there, etc. If you're listening to us on one of those fine podcast platforms, you want to see what's happening here in the studio, check out the Federal Newswire's YouTube channel. It's a great way to take a look at what we're doing here and get a sense as to what's going on. And please, as I just said, leave a like, leave a comment, subscribe, mash down on that subscription button, and most importantly, let your friends know, your family members know, and your family members' friends know all about the Lunch Hour with Federal Newswire and all of our podcasts here at the Federal Newswire. Very excited to bring on our guest. You know, I always get excited to bring our guests on. This is a gentleman who gave me the treat of speaking to one of my classes when I was still teaching. He came and spoke to my regulatory process class. He's got a fascinating background and insight into the real world implications of the regulatory policies that we're talking about. His name is Alex Adams. He's got a doctorate in pharmacology, a master's in public health. He's the director of the Idaho Department of Health and Welfare, appointed by Governor Brad Little in May 2024. Dr. Adams oversees a team of nearly 3,000 people and a $5.5 billion budget, driving initiatives to strengthen child welfare, improve behavioral health, and reduce regulatory burdens. Previously, and this is the capacity in which I spoke with him, he served as Governor Little's budget and regulatory director, leading Idaho to its first AAA credit rating and implementing groundbreaking policies like Idaho Launch and historic school infrastructure funding. He's a valedictory graduate of the University of Toledo. That's the one in Ohio, not the one in Spain. And our backyard, he's a Johns Hopkins MPH alumnus. I don't think I knew this, Alex. My mom has an MPH, not from Johns Hopkins, but from Columbia. And he resides in Eagle, Idaho with his wife and daughter. We're going to talk more about that. But let's start here, because when you and I were talking last, we were talking about the REINS Act. And we were talking about Idaho's, I will say, very unique approach to regulation and the burdens that are out there. Talk about how Idaho approaches the interplay between the legislative branches and the executive branches of government when it comes to regulatory development and implementation.
Yeah, well, I mean, as you said, for years, I mean, at the federal level, there's been talk about a REINS Act where, you know, the basic premise is the executive branch promulgates regulations, but if they meet a minimum economic threshold, they have to go back to Congress for approval. Idaho's been a pioneer in that literally for decades. If any of our agencies, we have about 60 that have rulemaking authority, if they promulgate a regulation, they have to go to the legislature for review and approval before they can take effect. There's a couple off-ramps for unique temporary rule situations, but in general, any regulation promulgated by an agency goes back to the legislature for review. The primary purpose of the review is to ensure its conformity with legislative intent, but what we've generally found is that every single year, there's a subset of regulations that are rejected by the legislature. On average, either in full or in part, about 5% of regulations are rejected. That might not sound like a lot to listeners, but one thing to know is Idaho's a supermajority Republican state. We have a Republican governor and executive branch. We have a supermajority Republican Senate and a supermajority Republican House. So even in a supermajority state, there is a subset of regulations that the legislature throws out for one reason or another annually. And it serves as kind of one of those powerful checks on the executive branch. You know, my agency, Department of Health and Welfare, as we promulgate regulations, and we've got a slate this year, everything from Medicaid to public health to behavioral health to substance use disorder rules. One of the things that's always in the back of the mind of us as an agency is, well, how do you think the legislature is going to respond to this? As we go through this, you know, in 6 months, we're going to be standing in front of the legislature and we're going to be justifying this. And can we stand in front of them and say, this is in line with the statutory intent of the original sponsors, and this will further the statutory intent, and why?
It's interesting because it gets to the heart of the issue, the pushback on the REINS Act by folks, and obviously it depends on who's in power in Congress, right? As we've seen, we've got this after the Loper Bright decision came out this last spring, we had certain folks in the Senate not liking the fact that agencies were no longer being given deference, and so they pushed this Stop Corporate Capture Act. Now I'm wondering if they would want to do that with the change in administration that's coming. But I guess my question is, because there are folks who say that legislation like the REINS Act essentially guts the regulatory abilities of executive branches, what you're telling us is that 95% of the time the regulations are going to stand, largely because it does act on this check and power. Talk about that. Talk about that kind of a record and how the fears may be entirely overblown.
Yeah, I mean, as I said, I mean, we're a supermajority state that probably facilitates a higher approval rate, and
Sure.
Certainly want to compare it to others. But a couple things that I've heard against the REINS Act, just playing devil's advocate, is the concern about the time burden on the legislature.
Sure.
One thing that's really interesting to know is Idaho's a part-time legislative state, so our legislature will convene in January. We don't have a defined end date, but it generally ends in March. So generally January to March. Sometimes it bleeds a little bit into April, but this is something that the legislature has prioritized. When they come back in January, traditionally the first couple of weeks of legislative session are just regulations review. The way it's set up in our state is regulations promulgated by an agency go to their germane committees of jurisdiction. So healthcare regulations that I promulgate will go to the healthcare committee in the House and then the healthcare committee in the Senate. If both approve them, they take effect. If either reject them, they do not take effect. And again, there's some nuanced differences with temporary regulations, but those are used pretty sparingly. In terms of time burden, it's something our legislature has prioritized. They've found a way to make it work in a part-time legislative session. And most committees complete their work, we calculated on average, within about 32 calendar days of the start session. So they're introducing legislation. They're doing oversight of appointments from the executive branch. They're doing concurrent resolutions and all of their other work, yet they still find time to prioritize this, integrate this into their committee business, and complete it within 32 days. In terms of the high approval rate, think of it like legislation. By the time legislation gets to the governor's desk, there's been this, dramatic filtering process. It's introduced in one committee. The public provides testimony. If it gets out of committee, it goes to the floor. There's debate on the floor. If it gets out of one chamber, it goes and, the process lather, rinses, and repeats in the other chamber. So there's multiple choke points for the public to weigh in, businesses to weigh in, interested stakeholders to weigh in, and multiple viewpoints to be heard. By having legislative review of regulations, it does round out the totality of feedback that agencies get, and it might make agencies a little bit more skittish to bring things that they know could be at odds with their legislature, hence the deterrent effect, which leads to perhaps the high approval rate.
Sure. But that's the way it's supposed to be, right? I mean, it's a situation in which we are supposed to be a nation in which decisions are made in a compromising, discussive fashion. It's funny because we talk about this issue, the protection of democracy, and this kind of a policy in a state like Idaho, it really serves to protect those democratic virtues in a situation in which you and I both know that executive branch power, whether it's at the state level or at the federal level, can be abused. It could be a great threat to individual liberty. The more opportunities the public has to say their piece on this, that's all for the better, isn't it?
Certainly. And I think it's improved. It's improved the business environment in our state, and it's improved stakeholder engagement in the rules process. So I think it's been welcome. I mean, we've done a couple other things. as a state that I would say are pioneering. I mean, pre-Loper Bright, we had a deference, non-deference pass.
Yeah.
And with that, this year, there's actually a piece of legislation that was designed to address the outcome of that suit, which is over time, through our Administrative Procedures Act, we do something called zero-based regulation.
Yes, I was going to get to that.
Have sunsets and have to be periodically reassessed. They added once every 8 years, a rule has to be reassessed, and now the reassessment includes looking at, does it make sense to keep it as a regulation, or should it be moved into statute? Now, you could debate what is the benefit if you're taking a policy from regulation and simply moving it into statute. Is the world incrementally freer? But what that does is that creates more certainty. There's less whiplash across administrations. It removes that tendency of the bureaucracy to maybe dial up the stringency of those regulations over time. So in consideration, the legislature put a couple parameters for consideration as to whether or not it should be moved to statute. Two of them are, does it make sense to have a one-stop shop in statute versus sprinkling things between statute and regulation? And then what is the frequency with which those regulations were updated? If it's updated frequently, there's an argument that agencies need flexibility. These things move quick. They can't be done in part-time legislative sessions from January to March each year. Agencies need the ability to change it quickly. What we found is the average regulation in Idaho changed once in like 11 years. So, I would have a high degree of confidence for my regulations at my agency that sometime once in 11 years, I could probably go back to the legislature and make a case for changing the stringency in either direction.
Sure.
So the benefit you have is by moving it from regulation to statute, it's now back at the hands of the elected lawmakers. You don't have unelected individuals tinkering with the parameters and having whiplash across administrations. The other benefit is, like I said, the one-stop shop nature of it. So like I license EMS, for example. So we might have a statute that says EMS shall have continuing education to be determined by the department with the following parameters. And then I have a regulation that says the following parameters for CE are as follows. They must be X hours. They must be these topics. Well, now you don't need a statute directing the reg. You have them in one shop. And what we found is, as we started moving statutes to regs, you could cut about 50 to 80% of the word count just by deduplicating things. So now it's in one stop, and it's a smaller, you can fit it in your pocket and read it and understand it a little bit more cleanly.
It's interesting because we're putting together the policy work that I do, putting together a list of 100 recommendations for the first 100 days. And one of the things I've been talking about for years, and the verbiage is very similar. I've called it the business compliance one stop. And the idea is that, it's 2024. Of course, I've been working on this for a while. In the same way we have regulations.gov, where anybody can go and comment on just about any regulation that's up for promulgation at the federal level. You should be able to, as a business owner, go into a web portal, type in, your NAICS code. For those of you who don't know, a NAICS code is a North American Industrial Classification System code. It's the code that says what kind of business you have. Put in what kind of business you have, where it's located, how many employees you have, and maybe a couple of other pieces of information. And it should spit out everything you need to be doing to comply, every piece of paperwork you need to be complying, et cetera, et cetera, et cetera. There's no reason why you can't do this. And I guess actually this gets into your other work before you took over this agency and your work on regulatory issues for the governor. And the impact of regulation on small business. This is going to be a little bit out of left field here, Alex, but one of the things that I talk about is time. That time is the only resource that a small business owner, that any business owner can't make more of. As the poet said, it's the fire in which we all burn. And I think we should be expressing more regulatory burdens in terms of the time it takes to figure out to comply. What you're talking about with this one-stop shop that, again, it gives that business owner back. Talk a little bit about time and productive time and this issue for these business owners.
Yeah, I'll give you a couple specific examples. Previous agencies that I ran was our Charter School Commission and Board of Pharmacy. when I was at Board of Pharmacy, when I started, we had 100 pages of regulations, and it was on things as granular as we must have a private bathroom for the pharmacist.
Oh,
And, it had just all these
wow.
tacky things. I got it from 100 pages down to 26 pages. I think my successor has gotten it down to 18 pages, which
Wow.
is 16 too many. But what we found is, as we got out of the business of delineating everything, I'll give you a very concrete example. I'll never forget this one. We used to have a requirement that the pharmacy have a solid core door. And, obviously the intent that it was trying to address was, in the throes of an opioid epidemic, you want security features to deter. But we had a small business owner buy an old bank building. Banks, as I understand them, are relatively secure facilities. But if you think of banks, they often have a lot of glass, like beautiful glass entryways.
Right.
And, this gentleman put in some security film where his glass door was basically bulletproof.
Yeah.
But it was not a solid core door. It was glass. So our inspectors failed him and was trying to delay the opening until he put in a solid core door. The business owner showed up at our board meeting and he was saying, I could put in a solid core door, but for the love of God, there's floor to ceiling windows right next to it that are not addressed in the regulation.
Wow.
So the board starts going down this whole, well, should we regulate windows? And then eventually we got to, these are bulletproof glass windows. And maybe the business owner has made appropriate decisions about how he's going to protect his inventory, because him and his insurer are also going to have a pretty vested interest in securing his inventory. So, we've addressed all that, got those regulations down, wrote them in plain English. I mean, your worst, no offense out there, but sometimes the worst regulations are those that are drafted by lawyers.
Of course.
So, shorter, easier to understand. Don't need an army of lawyers to help you comply. Good jobs follow. What we've seen since we deregulated pharmacy, we've had national companies relocate to our state. Amazon, PillPack opened some of their central operations in Idaho, and CVS, directly as a result, opened some of their central operations in Idaho.
Wow.
I'm aware of another one that's in the process of moving right now. We also saw pharmacies open telepharmacies, a unique model in rural communities. I was just at one where a telepharmacy opened in a town with a physical inventory staffed by a pharmacy technician overseen by an offsite pharmacist. They hadn't had a pharmacist in 80 years in that town, and now they have one. And in the throes of winter, they don't have to drive an hour to the nearest pharmacy.
Alex, hold on for a second, because that's really interesting. I obviously I'm doing a lot of work on socialized medicine, or pushing back on socialized medicine issues, and the issues of making sure that your local pharmacies can compete with some of these national PBM businesses, et cetera. This, I suspect what you're doing is unique in terms of Idaho. I don't know how many other states are talking about this, but drill down a little bit more on that issue. The what's happening, the regulations that require. We'll talk about the regulations and what they require and how this impacts these local communities, because these are the same kinds of rules that deal with the local practice of medicine and the issue of not being able to deliver telehealth. So talk a little bit more about this.
Yeah, so I mean, pharmacies are generally in rural communities a place to quickly get antibiotics, antivirals, pain medications, things like that. If you're running low on your diabetes medication, access to pharmacies is a critical part of your broader healthcare strategy. The challenge in rural communities is shortage of pharmacists, finding pharmacists willing to locate in that community, and having a volume of prescription dispensings that would support a pharmacist salary. Pharmacist salaries are over six figures in starting in most instances. So what we do,
hold on, and time out for a second, and just so you all understand this, this is also a direct relation to how much it costs to, say, get a doctorate in pharmacology, or all of these things. Education is expensive, so there you go. I'm sorry, go ahead.
Yeah, so a couple things. We're one of the states, and there's others. I mean, it's not the majority, but there's others that allow telepharmacy. So from the consumer's end, it looks, feels, smells just like a regular pharmacy, but it's staffed by a pharmacy technician instead of a pharmacist. However, it's supervised remotely by a pharmacist. So the pharmacist is still reviewing each prescription. Is this the right drug for the patient? Are there any risks of side effects, et cetera? But you have a pharmacist in a central location. Maybe it's here in Boise, overseeing 3 to 4 to 5 rural locations. So now you've pooled volume in a way where economically it makes sense and it can sustain that rural community. Benefit to the rural community is they have local access. They don't have to rely entirely on mail order or long drives. Benefit to the pharmacy is they can see multiple locations and get the economies of scale and the volume. The other thing, we're probably drifted a little bit from what you said.
No. This is exactly what I wanted to be. The whole point of this podcast is to be talking with folks who are doing the real work of implementing public policies. And so, going down these other rabbit holes is where we're supposed to go. Sorry, go ahead.
So the other thing we did is, what pharmacists can do and what pharmacy technicians can do is also a matter of state law and regulation.
Right.
We were the first state to allow pharmacy technicians to administer vaccines. And why that's important is in these rural communities where it's staffed by the technician, not the pharmacist, a vaccine is something that has to be physically delivered. A flu shot is physically delivered. And it can't be done remotely by the pharmacist. So by doing that, we also improve vaccine access in these communities for the consumers that chose to avail themselves to it. We were pilloried when we did that, to be perfectly honest. We did that in 2016, and then COVID hits.
Sure.
Only two other states had joined us in that fight. It was Rhode Island, Utah, and little old Idaho. Trump administration saw what we were doing and said, we need that in all 50 states. We need as many humans as possible.
Right.
Trained and able to deliver these, and albeit maybe at odds with federalism, but in a positive direction. The Trump administration in the Public Health Emergency Act overrode state law, allowed pharmacy technicians in every state to do it. Multiple hundreds of millions of vaccines have now been delivered by pharmacy technicians. And some of the original critics of us are now the ones monetizing pharmacy technician training of vaccines.
Well, I mean, but that's just it, right? And we could have, obviously, other discussions about federalism generally and the role of the federal government in setting this. But the reality is, this is why we have a federalist system. It's so that states like Idaho can go and experiment with these things, experiment with regulatory policy, experiment with the relationship between regulatory policy and how we deliver healthcare to citizens. I mean, we're in an era, we just came through an election in which the judgment of healthcare was about some very specific, state-based healthcare was about some very specific parochial issues. Whereas it's such a wide variety of things that go into how a state is providing healthcare. And as we're dealing with the overall shortage in the provision of overall medical care, right? We have a gap in the amount of doctors and nurses and physicians assistants we have versus the number of patients we have. The experimentation that you're doing in Idaho with these policies is proof positive. But let's talk about this, because there are always unintended consequences. Let's talk about some of the unintended consequences. What are some of the things that you didn't think were going to happen that happened with the enactment of, whether it's your, regulatory issues or these other issues?
Yeah, well, maybe first just kind of globally, one of the things we did as a state is we flipped the script on regulations. We now use sunsets across the board. Yeah. And agencies now have to justify keeping regulations. Otherwise, they go away by default. By flipping that burden, it makes it a lot easier to get rid of regulations, and it puts the burden of proof on those justifying regulations. As a result, statewide, we've eliminated about 3,300 pages of regulations, which is 38% of all regulations statewide.
And hold on, 3,300 pages of regulations. You said, well, that's 38%. We never do math on the air, but essentially what that suggests is you guys had 10,000 pages of regulation in Idaho. And that's not me making a knock on Idaho, but if you think Idaho has 10,000 pages of regulation, imagine what California and New York and Washington State have. But sorry, go ahead.
Yeah, we started off as a pretty low regulated state. I think Mercatus, when we started this journey, had us as the third least regulated state. We've been able to push out that much fluff. I mean, we had regulations on female kickboxing uniforms, a entire chapter of regulation
All
on
right,
snails.
Alex, you lost me there. Female kickboxing uniforms need the most stringent level of regulation possible. I'm sorry, I got to disagree with you there. Go ahead. I'm sorry.
Maybe not the state sport in Idaho, but
Yes.
we had regulations on snails that didn't exist in the state. We had regulations around a lottery game show that never aired. So, I mean, to be one of the least regulated states and have that much gunk
Sure.
just shows how much is sitting in the gutters of most states. And it's a lot of regulations. It's kind of like the drawer of old computer cords and cables.
Oh my God. Oh yes.
You probably don't need them, but something deep down pains you to get rid of them, because what if this was the one I needed for my old camera or whatnot?
Right.
And that's the reticence that agencies face. They know many of their regulations are obsolete, outdated, or just downright silly. But there's some pitying fear that if I get rid of this will have been the critical linchpin holding up this program, and I don't want to be blamed for that.
Sure. Right.
Change the default, and generally what happens is suddenly the janitor takes out that junk drawer, and you don't even worry about it.
Right.
You don't have to justify it. It's gone. So we got rid of all those regulations. So you asked unintended consequences. At no point during this process, I mean, the biggest cut was in 2019. We've never had an agency come back to the state and say, whoopsie doopsie, we got rid of something we didn't. We need to stand this back up. And we've never had someone come to us and say, by getting rid of X, the following consequences happened.
Right.
So that's not to say there's not online snark. Usually when the governor or anyone, myself included, posts something about deregulatory online, somebody will say, oh, what about this incident or that incident? And it never related to an actual state regulation that got away. It was, it might be an OSHA thing federally or stuff like that. But that's not to say there's not snark or cynicism. But at no point have we ever said we touched the wrong regulations. And in fact, I've seen some evidence. Our biggest gains at the state level were on occupational licensing reform.
Oh, yeah.
We got 2/3 of all regulations on occupational licenses. So there's a chart that goes like this in pages of regulations. The number of complaints and disciplinary actions from those boards have basically tapered off as well.
Really?
Complaints haven't gone up, and disciplinary actions haven't gone up. Some could say, consumer complaints dropped post-pandemic. So, I mean, some could say there's confounding factors, but at the same time, nobody can point to actual, concrete, objective harm. So, I mean, in terms of unintended consequences, I don't know that anything could be credibly pointed to as a public safety concern, at least based on the totality of what I've seen. I would say, there's a bit of whiplash to it. We originally set up zero-based regulation where regulations were up once every 5 years. Legislature extended it to once every 8 years. Once every 5 years is still pretty aggressive. So it was causing a lot of work for agencies and I think some uncertainty for industry.
Sure.
So I think piecing it out to 8 years probably made a little bit more sense. And, I would also say, one of the surprising things, maybe not an unintended consequence, but a surprising thing is people hate regulations in abstract, but people have a very hard time identifying specific regulations.
Yes. Oh, yes.
And when they do identify specific regulations, they hate 8 times out of 10. It's a statute, not a regulation.
Right.
A local zoning issue, not a state regulation.
Sure.
Or a federal regulatory restriction, not a state restriction.
Right.
A lot of it is like separating what levers of power do we actually have as a state. The other thing I would say is deregulation at state level often feels like, more like Tony Gwynn than Ken Griffey Jr. You're singles. You got a high batting average, but it's a lot of singles. It's not a lot of home runs. It's not as sexy because, regulations have to stem from statutes. So if I have the board of shorthand reporters, which legitimately exists in Idaho, I can, through the regulatory process, make it easier to enter that profession. I can lower their renewal burdens. I can eliminate their continuing education requirements or lower their fees. But whether or not there is a requirement for licensure for shorthand reporters writ large is a matter of legislative statute.
Of course, yes.
I can hit the singles I can't hit the home run.
Yeah,
So I
but
mean,
listen, as Crash Davis in Bull Durham said, you just hit one little dying quail more a week, and you're in the Hall of Fame. So that's the important thing here. Um, you know, so let me ask you this. So hopefully, hopefully the folks who are going to stand up this Department of Government Efficiency in the Trump administration, hopefully some of these new appointees, hopefully some of the folks up in Congress, if they aren't already talking to you, that they're going to be talking to you come January. When they come a calling, Alex, what are you gonna say? What are your recommendations going to be as to how? And listen, I'm shamelessly saying that I'm going to steal this from you, but I'm going to give you. I give you credit. I'm going to give you credit. Alex Adams says, but what would you say to these guys if they came to
well,
you?
I mean, I'd say they're taking notice. Both Elon Musk and Vivek Ramaswamy tweeted about what Idaho did this very week, and collectively it got like 25 million views.
There you go.
They tweeted the chart of our regulations increasing and then rapidly decreasing. And I think Mr. Musk tweeted it with a heart emoji. So I think people are taking note that states can be laboratories of democracy, even in the regulatory space, and that some things work. What I would say generally is you've got to do two things. You've got to smother the introduction of new harmful regulations, so moratoriums and generally slowing the issuance of new regulations. But slowing is not enough. You also have to take a machete to the regulatory rainforest that exists. So you have to do something to reduce the backlog of regulations that are already on the books and
Yeah.
already exist. And I've adapted a saying. I said regulations rise like rockets, but they fall like feathers. They're not
Yes, I
off
love
the
it.
books. So the only way to do it at scale, and the only way to do it in a time frame that Doge has suggested, which is to sunset gloriously on July 4th, 2026, you've got to put in place procedural speed bumps that flip the script, that change the burden from agencies. Hey, what do we want to cut? Let's look through all these regulations and see what we don't like. You need to set the default. They sunset, they go away.
Mhm.
Unless the agency goes through the process of
Right.
justifying it fairly with notice and comment and stakeholder engagement and ideally legislative oversight.
I love it.
So changing the burden and using sunsets.
Yeah.
States have used sunsets successfully. I would submit Idaho is probably the case study that has most successful use of sunsets, but it's been dabbled with elsewhere, including in some blue states like Rhode Island with some pretty good results to show for it. At the federal level, the most significant use of sunsets was at HHS under the Trump 45 administration.
Yeah.
Brian Harrison, chief of staff to Alex Azar, kind of pioneered the sunset for federal regs. And then unfortunately, it was undone, like many good things, by the Biden administration. But I would submit that what HHS had done with Brian Harrison's leadership is not too dissimilar from what Idaho has done with sunsets. Sunsets flips the script. It changes the burden. It changes the incentives that government actors are working under. And rather than layering incremental regulations off of incremental regulations, they go away by the default. And then of what remains, the agency has to go through the process of justifying it anew. And that can be a significant catalyst for broader reform. That would be my advice, is to set up rather than set up teams to, hey, what do we want to cut? What should we look at Treasury or Ed or HHS? It's how do we change that incentive structure and do it at scale and do it in a time frame that's relevant to this next administration making the progress that I know they can achieve.
Yeah, it's one of those things. And again, so turning around and then being able to point to Idaho and Idaho as an example as to how the sky didn't fall after you do this, I think is very, very important. Did you ever think, I mean, you and I have never talked about this, or if we did, I don't remember when you came and spoke to my class. How did you go down this road? I mean, obviously you were going in one direction with pharmacy school and getting your doctorate, and then you got your master's in public health. Did you ever think you were going to be doing this? How did you come down this road and get involved in this stuff?
Yeah, no, I mean, all careers are shaped by elements of pure chance. I mean, I started my career as a pharmacist and thought I would end my career as a pharmacist. But if you look at any state's regulations, I would say Your pharmacy regulations are among the stupidest at the state level. How much light needs to get to the back of your counter? How much square footage do you need to compound? And it's just this thicket of stupidity.
Yeah.
And it's not hard to have, it's not hard to develop libertarian slash movement conservative leanings just reading your state board of pharmacy regulations. So, after years of feeling like I was being smothered in what I was able to do in practice, I had the ability to run a board of pharmacy and said, I'm going to do this the right way. I'm going to start deregulating. I'm going to allow pharmacists to practice as pharmacists. And suddenly it's started a bit of a movement and a cottage industry within the pharmacy profession. And the concepts of that were transferable to other professions. We did it in the charter commission.
Yeah.
I got rid of every single regulation on charter schools, moved them to statute, gave them longer runways. If they're performing, they now have to appear back in front of their regulator once every 12 years instead of once every 5 years. Give them the leash, give them the earned autonomy to do what they need to do. It worked in pharmacy, it worked in charter, it worked in other areas. And, as you peel it back, the arguments for and against regulation cut across industry. Right. Once you have a general framework for how to regulate, you can apply it to land matters, to logging safety matters, to occupational licensing matters, to building code matters. So, it always cracks people up when I'm engaging on a matter related to Medicaid regulation or EMS licensure, and I'm a pharmacist, but, it's less about the degree and more about the approach.
Right. And the real world experience there. So listen, before I let you go, and you've been very generous with your time this morning, one of the things, and I should have warned you about this before, one of the things I like to do on this podcast, and my listeners have heard me say this, but I haven't explained this to you, so I will. When I was conceiving of adding another podcast to my repertoire of podcasts, because I have several, I was going to do one called Outside Interests. And the idea was to talk to folks who are in the political or policy world about things that have nothing to do with politics or public policy. Call it outside interests. It's now been distilled to sort of the final question of the show, which is when you're not doing this work, what are you up to? What are some of your outside interests? I know you're married, you've got a child, you could talk as much about that as you want, but what are you doing when you're not doing this work?
Yeah, I've got a 6-year-old daughter, so most of my time outside of work is working with her. She's starting the process of reading, and she's really good at it. So we're helping her read and reading everything to her that we can. So that occupies most of my time. We like to do a lot of outdoors activities. We like to hike, we like to bike, and Idaho is certainly ground zero for that. We're blessed to have access to outdoor recreation in every direction from downtown Boise, and then. Also like sports. I'll put out a plug for my Boise State Broncos, the number 10 team in the nation, and Heisman hopeful and the should-be Heisman Ashton Jenney. So I've been to every home game this year, and we'll be at our Mountain West
terrific
game on Friday.
I got to tell you something. We used to drive across country, not every summer, but every other summer, a little bit more frequently than that, because I grew up on the East Coast. My grandparents were in California, and one of my favorite places to visit was Idaho on that cross country trip. I will never forget, there was this Holiday Inn in Pocatello, Idaho, with a holodome, which was the big thing, these indoor pools that were just fantastic. So not that I'm defining Idaho via the Holiday Inn in Pocatello, Idaho. Idaho is a beautiful state, to say the least. Alex, how do folks find out more about the great work that you are doing?
Governor Little's executive order on zero-based regulation is generally what I would say is one of the cardinal documents.
Yeah.
If you are trying to dip your toes into the deregulatory space, it was Executive Order 2020-01. I would start there and work my way down.
And though, we're not promoting it entirely, if you go and you Google Alex Adams and both the REINS Act, REINS, as well as zero budgeting on regulation, you're going to find some really great academic pieces on these issues. So go and check those out. Dr. Alex Adams, thank you so very much for joining us today.
Thanks for having me.
This has been yet another episode of the Lunch Hour with Federal Newswire. As I've said, you can find us on one of those many podcast platforms that are out there: Spotify, Amazon, Google, Apple Podcasts, etc. If you're listening to us on one of those fine podcast platforms, check out the Federal Newswire's YouTube channel. If you want to see what's happening in studio, please subscribe, leave a like, leave a comment, and spread the word of mouth about the podcast. Let your friends and family members and your family members' friends know about it. I am Andrew Langer, your host. Enjoy the rest of your lunch.
This has been the Federal Newswire Lunch Hour Podcast, hosted by Andrew Langer. Check out the Federal Newswire's family of websites, as well as their social media stream.